Mr. Solisas, could I just start with you? I've heard from constituents in my state, which is Missouri, that the Department of Defense is not releasing information about the number of service members on a given installation who have been vaccinated. Is that correct, to your knowledge?
I don't know exactly what's being released in Missouri. We do keep track of the service members that have been vaccinated, and so we do have that information if you'd like that, Senator.
Would the department consider, do you think the department should consider releasing this information so that states and local communities have a better sense of who has been vaccinated, what the vaccination rates are around these installations?
I think that's reasonable. I think what we're talking about is releasing when we vaccinate somebody, we share that information with CDC, which can share that with the public health individuals in the state to make that available to them. So I'll look into that, Senator.
Great. I appreciate that. Thank you very much. General, let me ask you, and Senator Tillis, I think, asked a somewhat similar question, but I think this is important, so let me just come back to it. What, in your estimation, are the most important steps that we can take to ensure that civilian agencies lead responses in future public crises, with the department supporting, of course, but in a way where the civilians are leading the response so the department can stay focused on its vital mission, which is defense?
Senator, I think the key word I would tell you is being able to operationalize to effects. Right now, my assessment, right, albeit not very experienced in this world, because I've been in the Army for 38 plus years, is that very, very good at policy and defining, how things ought to be, but executing is a shortfall. So how do you operationalize to the effects that you want is the reform, I think, that'll be necessary in your assessment when you look at these organizations to do something similar as a potential future pandemic.
Do you have anything to add to that, Mr. Solisas?
Senator, I do. Most of the organizations obviously are regulatory organizations. The U.S. military and the Department of Defense have tremendous operational capability. I think going forward that there will always be that partnership where the Defense Department will partner with our federal partners in support of state and local authorities. I do think that there are opportunities for other federal departments and agencies, particularly as you see the acquisition business that we're in now. There may be the opportunity in the future to have that kind of contracting capability, because what we're doing really is leveraging the private sector here in the nation to respond to this crisis in a lot of ways. So how we do that going forward as a federal government, across the federal government, will be very important.
Very good. Let me ask you, while I have you still, Mr. Solisas, how COVID has affected the department's operations around the world, and I'm particularly interested, have we seen any sustained impact in operational tempo, and particularly in Indo-PACOM, our pacing theater?
Senator, as you know, the department every day tracks the readiness of the department, and I want to state unequivocally that we're prepared to meet every mission that we have in the Defense Department. Now, with that, obviously, we've learned a lot how to adapt and how to operate in the COVID environment, and we're using that. Our accessions, we're meeting our accessions right now. Our follow-on MOS schools, our service schools, all of those things are full up. We're using virtual type of capability to make sure that we can continue the education programs that we need to for our military members, our training, our exercises. Obviously, some of that has been curtailed, but we're finding ways to adapt and make sure that we're maximizing both the individual and collective training that we need to execute to ensure that we can meet our missions. And we're monitoring this very closely as we go forward.
Good, very good, thank you. Ms. Cummings, can I just ask you, how has the department's response, I should say, to COVID impacted the pace of modernization and then any other priorities in the acquisition and sustainment space?
So thank you for that question. Some of the, we have had to adapt to telework. That is one thing. Program offices are very used to being all together in one place. We've had to adapt to that, and I think we've done a fantastic job doing that. When I initiated the Joint Acquisition Task Force to assist HHS in assisted acquisition, we never met our teammates. All of our work was done on the phone. We created policies so that we could do things electronically that previously all required paper, actual pen and ink to get contracts signed. So we put a lot of different policies in place for us on the government side. And we also created flexibilities for our industry partners so they could continue to meet our needs. There are some things that did have to get pushed back. The Section 3610, for example, of the CARES Act gave us the ability to reimburse contractors for paid leave. Due to COVID, we didn't receive an appropriation for that. And so there are some things in the future that could impact modernization, and we're working through that to better understand it and be able to share that information. Thank you.
Very, very good. Yeah, thank you for that. Thank you all for your testimony and your tremendous service. Thank you, Mr. Chairman.
Thank you.